Okay, so I just want to do a quick update about things that are going on in my life. I'm probably not going to touch on changes like testosterone and chest in this video because there's like another topic. I just want to do a sort of update on where things are at with lower surgery and how things are progressing in that direction at the moment. So as I've previously mentioned in videos, I was referred by the Laurels for a chat with St Peter's Andrology, which is the surgeons who do lower surgery based out of London. It's not a full referral and it wasn't a full consultation. It was basically them meeting with me and going through my options because I can't yet have a full referral because I haven't met all the criteria. I still need to be a year on T and I need 2 separate assessments. So that will happen quite quickly. I got my letter, or my copies of the letters to them about 3 weeks after my appointment, and then within a couple of days of that they rang me up and said, we want to offer you an appointment for about 2 days time. I couldn't make that appointment, which was actually being held down in Exeter at the Laurels. They got me in on the soonest day that I could do with Mr Garaffa in Highgate in London. The actual consult wasn't bad, it just wasn't perhaps living up to my expectations of what would happen and what would be covered. I sort of got the impression that he thought it was a bit pointless me having a consultation when I wasn't yet a year on T, even though I was only a month off it, and I perhaps didn't get all the answers that I wanted to get, which made me feel a bit disheartened when I got out of there. He's prompted me to do some more research because some of the answers that he's given don't match up with what I've heard from other people. It was a bit concerning at the time, and it did make me wonder whether he was completely telling the truth about everything. To begin with, I was quite adamant that it couldn't all be true, but since doing some more research, I'm not really sure, so I'm hesitant to say anything about what my concerns were because I don't know how right or wrong I am anymore. So in that respect, it's thrown a spanner in the works. He was quite forearm positive, if that makes sense. He was quite keen to sing the praises of forearm phalloplasty, but he was open to doing a metoidioplasty, and he actually brought up the fact that you could have a metoidioplasty and then later have a phalloplasty, which isn't something that I think would be in the pipeline for me, but it's interesting that he brought that up almost straight away rather than me having to inquire about it. And I suppose I am slightly interested in that knowledge because my priority is standing to pee, and there's always the chance that in metoidioplasty I just won't have the length to do that, or to do it through clothes at least. So it's quite reassuring to know that it wouldn't be the end of the world, even though it wouldn't really be particularly fun to go through another whole set of surgeries. And sort of said that he wouldn't do thigh or abdominal on me because of my weight, as in I've not got enough skin for abdominal / pubic, whatever you want to call it. I'm not really that interested in thigh anyway, I've never really considered it to be an option, and he did mention that it can have an effect on the use of your leg, which again, I need to work. In terms of metoidioplasty, he didn't really say that much, which is kind of annoying because that's what I want to find out about most. Yeah, so I'm not really sure what my opinions are on that appointment. I think I will ask to see Mr Christopher next time when I have my actual consult, just to get a bit of a more well-rounded viewpoint of either of them. But he wasn't a horrible person, there was nothing really majorly problematic with what he said. It was just, it didn't instill that much confidence in me when a lot of people have been told other things and I've been told this. Yeah, I think I'll see someone else next time and just use all that as information to base my plan of attack on. In other news, I've got a letter from Dr. Dan Hodgson, who does the second opinions for lower surgery for the Laurels, and I've got my appointment with him. My appointment, I think, is the 24th of May, so that's a long time away, which is frustrating because I just want to get everything set up and in place, but at the same time, it's not that big a deal for me because I don't want to rush this and I want to get other aspects of my life sorted out first. I'm in my last year of my apprenticeship, and I'm thinking of getting a house before I have surgery, and just so I can sort all that out. Although I do wonder whether it would be a good idea to stay here. I'm just around the corner of the doctor's surgery. I don't have stairs to worry about or anything like that. But I think I will see how everything else is going in my life before deciding that. I just want to sort all my apprenticeship out, get that dealt with, and then tackle lower surgery. Give myself a bit of a breather from me and surgery and translated stuff and the NHS and all the rest of it. So I guess that's kind of it for how things are going at the moment. Still a lot of things going on, obviously. More so now that I've got a new therapist at the Laurel, so I'm going to have to start going to those appointments again, which it's something I've got to do. Not particularly looking forward to it, just because I've got a thing about therapists, and my therapist, which is the only therapist that I've ever got on with, is no longer seeing patients, or at least no longer seeing me. He's had some health issues. We will see how that goes with the new person. Yeah, so that's about it, I think.